Hundreds of protesters demonstrated in central India today. They're demanding punishment for health officials over the death of women in botched sterilizations. At least 10 women died and more than a dozen are in serious condition just days after surgery at a so-called family planning camp in their village. These camps are held regularly in sections of rural India as part of a government effort to control India's rapidly growing population. Authorities reportedly suspended at least 4 doctors and are continuing to investigate this incident. Anita Bajpay is on the board of the directors of Manavi, which is a South Asian women's rights group, and she's here in our New York studios. Welcome to Rise America, Anita.
Thank you so much.
It's horrifying to think of. Can you just give us a little more insight in what's going on with this? What are these so-called health camps?
Well, I think in this particular case, they are state government, state-run camps, and they're offered as free clinics. So that's the incentive they're offering the women. And the tragedy is that these operations are not done in surgically clinical situations in which conditions are sterile and safe. And these women are rushed into these procedures without being properly educated or informed as to what exactly is going to be entailed. And the shocking news is that about 80 plus surgeries were done in 6 hours, which is absolutely horrifying because typically a procedure like this takes about half an hour per case with post-op care, and none of that was provided here.
This is absolutely unimaginable. So what does this reveal about the general public health situation?
Well, I think in this case, it's shocking. I mean, it's deplorable. And I know that with the new Prime Minister, there's a lot of talk about reform in the healthcare. And this certainly is a big red flag to indicate that there is a big need for care.
Tell me about the popularity of these camps. You mentioned that it's done at no charge, which is appealing to many of these women. So economics clearly plays a role here.
Right, and as it is, I mean, women are the ones who have to bear the brunt of having multiple pregnancies. So they're already, interested in taking some kind of contraception procedures. And these free state clinics are, of course, what we're hearing is that they are being driven by incentives for controlling population and filling quotas. So they are set up in different places, and in this particular case, Chhattisgarh is one of the poorer states in India. And these camps are set up, and women are pretty much forced to go into these facilities and get these procedures done.
I was going to ask you that, if they have a choice in this. And in the conversation we've had so far, I've not heard you mention men at all. So there is no obligation on the male's responsibility in reproduction?
Well, there is huge. In fact, if you compare the procedures for women's sterilization as opposed to vasectomies, I mean, the procedures for men are much simpler and much safer. I mean, these are very big surgeries. These are big abdominal surgeries which women have to undergo. But unfortunately, there is very little education or push that men should undergo these sterilization procedures instead of the women.
We certainly see disparities amongst genders all over the world. The United States is no exception. So is there a cultural underpinning then laying this all at the feet of the women in terms of controlling population?
Oh, definitely. I think women in a country like India, for example, it's a very patriarchal society. And women have very little control on their bodies and in their choices. I mean, they should be given the options of several other contraceptive measures. And unfortunately, they don't have a say in the matter.
Is there, what is and this might be too broad a question, but is there a general perception or feeling in India about contraception? Because many cultures, many religions have objections to contraceptives.
As far as I understand, that is not the issue. I think it's this particular procedure, laparoscopic tubectomies, is the most popular contraceptive measure in India. And in majority of the couples, that seems to be the preferred method. But that is also because the other choices are not offered as readily. And women many times don't have a choice in expecting the male partner to adhere with those other choices. And so for their own, I guess, long-term safety, they think that, once this is done, at least they will not have to have the burden of having multiple pregnancies if they were not wishing that.
Based on what you observed, might these deaths be enough to change the system?
Well, I certainly hope so. I mean, even one death is more than enough. And in this case, 11 plus, and then we're hearing that among the 80 surgeries, about 40 other women are doing very poorly. And they've been having several post-operative side effects.
Yeah, it's just horrendous, certainly unacceptable. Thank you for bringing this to our attention, Anita Bajpay. Thank you so much.
I appreciate it. Thank you so much.